Risa, welcome to the podcast. So happy to have you with us. We are going to talk all things autoimmune and a little bit about the thyroid as well. So why don't we start the conversation with you telling us a little bit about your backstory and how you even got into this. You're now a functional nutritionist and certified autoimmune coach, but that wasn't always the case. So tell us how you got so interested in this, because I know you have your own personal story that goes along with this.
Yeah, well, thank you so much for having me, and it's really great to be here. And yeah, I think most of us have our own personal story behind our healing journeys, right? And mine was that I grew up in a house where my mother was always on a diet. It was just always, that's I'm dieting and I can't have that. And there's a lot of restriction and a really bad relationship with, these foods are good and these foods are bad. And it was just the same 5 to 10 pounds she was always trying to lose for my entire childhood. My grandmother did the same thing. So I was around this conversation all the time. And as a kid, I'm thinking, the bad foods that you call are bad they taste really good to me. Like, why are those bad? Right. So I had a lot of food confusion growing up. And then when I was sort of perpetually on a diet, always, working off those 5 pounds that, I would gain, and then I would diet, and then I would, we all did that, right? Yo-yo thing. And then I had this fascination with health. And when I got married, we conceived our first child just absolutely effortlessly. And it was easy. Everything was easy, and easy pregnancy, everything. And then we tried to conceive our second, and I just couldn't get pregnant. I just couldn't do it. And occasionally I got pregnant a couple times in that 4-year span of trying, and I lost the baby both times. So it was really, really hard. And when I went to the fertility specialist, I finally gave up and went to a fertility specialist, and he did some blood work and said, "Oh, you have an underachieving thyroid. So here's a script." And, and I said, "Oh, how long do I take this for?" And he said, "Every day." And I said, "No, no, no. How long do I take this for?" And he said, "Oh, for the rest of your life." And I thought, there's something that my body is supposed to produce. I was born with all the equipment to produce it, but I'm not producing it. So why are we not asking, why am I not producing it? Instead, we're just taking the synthetic and just making that do what the body is supposed to do. So that really kicked off my journey on why my body wasn't functioning and the foods that I was eating. And it really joined, and that was really where my journey started. And I researched and researched and researched, and eventually I was diagnosed with autoimmune disease, Hashimoto's. And after my son was born, I eventually did conceive after I did acupuncture and changed my diet and did some research and things. I did it naturally. And I started going down that road and realizing, why is it that I do have autoimmune disease? Why are people getting autoimmune disease more than we ever have before? I grew up not even knowing what this was. And I don't think my grandparents were even tested for this. Why is it that this is so prevalent now? And I created a checklist because I couldn't find one at all anywhere. And so I created one. It took me years, almost a decade, to go through each one. And I developed a list of root causes of autoimmunity, and a third of it turns out is genetic. Doesn't mean you're gonna get it, but if you have the genetics, you're more more susceptible to having autoimmune disease. And another huge chunk is leaky gut, and that's just a huge topic, right? And it's something that conventional medicine doesn't talk about. And so I thought it would be really important to have this conversation. And I did a deep dive in it. And that's why I do my stool testing with everybody I work with. And then the other root causes are things like toxicity, toxins, a buildup of toxins. And it could be pathogens or viruses or bacterial infections. And it could be a lack of vitamin D that could get it going. And then MTHFR, a gene mutation that I test everybody for. And those are typically in mercury poisoning. So I went through each and every one, and it took years. I rattle that list off like it's nothing, but it took me years and years and years to create that list and go down every single path. So people didn't have to.
Yeah, so I completely identify with your story. My son got very ill in 2016, and same thing. It was an autoimmune illness, which we treated it as an infection, and it actually cleared up within a couple of weeks. But during that time, it was absolutely awful. There was no help whatsoever. And it's like the conventional medical people are trained how they're trained. But I remember having those same conversations. Well, he's got ulcerative colitis. I'm like, well, why? Well, we don't know. We don't know what causes it. Well, why? But what, like all of these whys, like, don't you want to know for your other patients instead of just saying, here's your diagnosis and here is the medication or treatment, or, and usually you super toxic. Like, why aren't you as a medical person, why aren't you asking the question, why? And it's just, it's in the training. And unfortunately, they're not asked, they're trained to just diagnose and treat. And so there's just more and more of an influx, and not only autoimmune disease, but more people asking the question, why? Like, what can we do about it? And so when you rattle off that list, that was like the same for me. Like, I just did deep dive into all of these things, like nutrition and, vaccine injury and mercury and metal toxicity and mold. And it's so overwhelming, one, to get diagnosed with an autoimmune disease, two, to try to get help for it, but never feeling like you get to the base cause. And like you were just said, oh, take this medication for the rest of your life. And it's highly, highly frustrating for those people who truly want to heal their body. And so I so respect your story and what you did. And it's not easy. It's not easy. And a lot of times you're gaslit. There's a lot of gaslighting going on in the doctor's office. And even if they truly want to help you, and I felt like this was the case with the pediatric gastroenterologist that we were working with when my son was so ill, like he truly wanted to help, but he just didn't have the right tools. And if he learned about tools or alternative approaches, he wasn't allowed to let us utilize them because it wasn't in the standard of care. So there's so many frustrating components going on, and the standard of care is like, it's like if you deviate from that at all, you can get your medical license pulled or revoked, or, you get in some big trouble for that. So where are you at now? Well, let's talk about the testing that you talked about a little bit. In particular, the stool testing, how did you get to the point of knowing, like, I need to get my stool tested? Maybe you had some food sensitivities testing. Like, how did you get to understand, like, okay, these are the things with Hashimoto's and, the autoimmune illness that suppresses the thyroid function. How did you put together how to come up for what to test?
Yeah, that's another great question, and I'm super glad to hear what you did for your son, because it's just so important to ask the why. And our paradigm is sad, and that's where the birth of functional medicine came in, because those MDs were feeling like they weren't able to help their patients, so good for you for doing that. But for me, my story was, this is so long ago, but when I first was diagnosed with Hashimoto's, and I changed my diet, I did all these things that I could, and I was going down that list. I would spend, I don't know, maybe about 2 or 3 years almost. I put my kids to bed, and then I would sit on my computer and I would search for a functional medicine doctor. And I finally found one. Literally, it must have been 3 years. And I drove a couple hours away to go see this doctor. And I just remember crying all the way home, because it was a sense of relief, like somebody understood. And I was doing so much on my own and taking all the right supplements and doing all the right stuff. But it still wasn't, it was something that was my blood sugar started going up. And then of course I was vegan, and then I couldn't eat fish because I was going through chelation for my heavy metal. So there were so many avenues I was going down at the same time. So I worked with this guy, spent a fortune, and ordered more tests, more of the same tests that I had ordered. And I was 99.9% compliant, and, no sugar, no dairy, no alcohol, no, all this amazing food I was eating, and lifestyle. I was running and working out, not too much. Anyway, we did our follow-up test about 3 months later, and the needle moved an inch. And I mean, I do blood work all the time, every day, and I can see it move, quickly, typically. And if you're moving that slowly, then usually something is holding it back. So I ordered a stool test, and there it was. I had some bacteria overgrowth, and my cholesterol at the time was so high. And I was almost pre-diabetic. My A1C was at 5.6. I ate zero sugar. I had a lot of beans, and I had some grains, some quinoa, but not that much. But it was all the carbohydrates I was eating with it. But I said, something is driving up my blood sugars. So I took my stool test to a biological dentist, and I gave it to her, and she took one look and she said, oh, that's a salivary bacteria. And in 10 minutes, I was under the ultrasound, and they did an X-ray basically of my mouth, or an ultrasound, and they saw that 23 years prior to that day, I had had my wisdom teeth removed, and they left a root in that cavity, and it created an abscess. Now I have felt nothing, zero. I have no pain, it wasn't swollen. There was no symptoms at all. So I ended up having a surgery where they went in and removed the root, and they found a piece of metal that happened to have been left in there while they were in there. But once that was removed, my healing process really started. So, and my cholesterol came down. And so it's what I dig and I dig and I dig and I dig until I find it. And the mouth is so connected to cardiovascular. I did a panel on my heart with the Boston Heart Lab, and my markers were really high. And I'm like, how could this be? Like, nobody eats cleaner than me. I exercise, I do all the right things. There's something here that doesn't make sense. I was able to find it. And then, I went down that road. So I literally went down every road. So that is where I found the stool test. And now I work with the stool test with every person I work with. Everybody's going to get that and a blood test after the first day that we work together. In that stool test, we're looking for 84 pathogens. So we're looking for C. diff, salmonella, giardia. We're looking for fungus or candida, yeast overgrowth. We're looking for parasites, worms. We're looking at your good guys. How much good guys do you have? And we're looking at your bad guys. How much overgrowth do you have? I worked with somebody a couple of times with colitis, and in their case, their root cause was a pathogen overgrowth that they had that caused their colitis. We took care of that, and they are asymptomatic completely. So it's amazing from somebody who can't really leave their house in the morning because they're having chronic diarrhea to living a totally normal life, traveling all over. It's just an amazing impact. And then it looks for parasites and worms. I think I said that. And then we look at a whole intestinal health. So are you having a hard time digesting your fats? Are you making enough pancreatic enzymes? Inflammation in the intestinal lining? Are you at battle, your secretory IgAs, your immune system in your gut? And then we're looking at leaky gut, how you do with gluten or a protein that is prevalent in gluten and things like that, so that we have an idea how much inflammation is in the intestinal lining. Then that gives me the target, right? I always say I'm not really good at playing darts with the lights off and I cannot see the target. I'm going to start guessing, right? That's what we do in conventional medicine. I don't do that. I want to know exactly what we are addressing. And that is an amazing test that I use.
Yeah. So do you use the GI map or do you use a different GI map?
Yeah.
Yeah, it's very comprehensive. And both my children who have had some struggles with health issues have both utilized that. But yeah, colitis, when you say people can't leave the house, it's literally like I would try to drive my son to school and I'd have to stop at the gas station on the 7-minute drive to school. And he was getting to the point where he wanted me to homeschool him. So it's just, if you can find what is causing the issue and fix it, then that's game changing. And we haven't had an expert on the podcast relating to mouth health, but we should really get somebody on here because yes, I mean, it can drive inflammation. And I always thought this with my mother. She just passed away a few weeks ago, but she had like I always thought, I'm like, Mom, I think there's something going on in your mouth. Like she just had a lot of metal in there. She was in her 70s. She had a lot of work done. And I just thought we need to get this checked out. But in our area, there aren't really there's like 2 functional dentists in the entire state, and just not anything that was ever pursued. But I do wonder, I'm like, gosh, and so much inflammation can be driven from the mouth. So it's really interesting that you ended up finding that, and that it really moved the needle with your healing. Because you're right. It's like if you're doing all the things and supporting your health, and it's just there's something underlying that needs to be addressed. And it's like peeling back the layers of an onion. And sometimes it can take months, years, but you just keep peeling it back and peeling it back. And like you said, digging and researching, and usually you can finally find a base root cause. So you gave us a lot of the testing, which is very helpful. Do you do food sensitivity testing, or do you do more of an approach where like the autoimmune protocol, or how do you decide how to nutritionally treat? 'Cause that's a huge part of it. And it can be really, really frustrating. I've done that myself where I'm like, okay, I have some bloating issues and I take out this and I take out that, but it was never officially tested. And so people can just, spin their wheels nutritionally thinking, oh, I'm going to hop on this protocol or diet. But it's not appropriate for them. So I always make the statement on my social, on my podcast, like what works for me isn't going to necessarily work for you. What works for Risa isn't going to necessarily work for the next person. So what do you do nutritionally when somebody is working with you and you suspect nutrition might be a big part of it?
Yeah, well, nutrition is a big part of it, no matter what, because what we feed in our guts, it tells us what our microbiome is, and our microbiome is talking to the brain. And it's basically, the 2 foundational issues that I look at with everybody are inflammation and gut health. Because at the end of the day, inflammation we know is the driver of disease, and gut health is responsible for everything. 75 to 85% of our immune system is produced in our gut, but everything is really based on our gut. And we're going more based on our science is moving more to the gut than it ever has before, because it really is the baseline. It's the determining factor of really pretty much almost everything. But so nutrition is something that I look at. And you asked the question about food sensitivities. When I first started my practice several decades ago, I would immediately have them do a food allergy test and be like, oh, these are the, here's some data. Here's the food allergies that you have. And then after years, I thought, some people would have all these food allergies. And I'm like, well, you can have some water,
Right.
It's like, what am I going to eat? And I realized it wasn't the problem. It was a symptom of the problem. So I don't do a lot of food allergy testing with everybody, but I do it. But I do more cross-reactivity testing, and I do food allergies with some people, but not with everybody, because what I realize is the root problem is leaky gut. And if you have leaky gut, you're gonna have food sensitivities. We have these gaping holes in our intestinal lining that things are going to go through, and it's going to create antibodies because it's coming in through the back door, and the body says, who are you? You're the enemy, and it creates antibodies. Those antibodies will then cause inflammation and food sensitivities, because it knows that, let's say gluten, for example, if they don't like gluten and they immediately are programmed to attack the gluten. Well, what if you're eating sorghum, which sorghum has a very similar molecular mimicry, is what we call it, but a protein structure. And that protein structure, and sorghum's in all these gluten-free products, and you're eating sorghum and your body goes, oh, there's the enemy again, and it starts to attack it. For that reason, I will definitely do the testing. And for other reasons, I'll do food allergy testing. But 9 times, and if you say to me, I don't care what the budget is, order whatever test you want, I want it all, then I'll order it. But it's not that helpful, because really what's more helpful is to know how big your holes are in your intestinal lining. Once we close those holes, and then we want to do food allergy testing, sure, then we'll see what you're having a response to, but you probably won't have much response to much, right? Because we don't have that backdoor entrance open. So I'm really focusing on leaky gut. And so I do a comprehensive blood test for sure. Everybody gets that. We're looking at all 4 markers of blood sugar. We're looking at all 9 markers of thyroid. I'm looking at a full iron panel, white blood cell breakdown, kidney, liver, things like that. And between that and the stool test, I can pretty much have a roadmap from there. Occasionally, I'll have to order more tests. We could do hormone testing or other testing. I test everybody for the gene MTHFR, which I mentioned, and that has a lot to do with your methylation process, which can cause inflammation. So we usually see that in homocysteine. I order also inflammation markers on that blood test. And then I'm now doing a lot of genetic testing as well. And I love the genetic testing because it just is who you are. It's your blueprint that you were born with. It doesn't mean it's your future or your destination, but it just means that that is your blueprint. And you know that if this road is going into danger, you can make a left and create a life that will not get you to that, right? So I do genetic testing for mineral and vitamin absorption. So you might have a high risk of not absorbing vitamin D through food. So you're going to have to get it through supplementation or eat more foods, focus on those foods that give you more vitamin D. It tells you about weight loss and how if additional exercise is going to help you lose weight, or just doing the certain amount of exercise that you're doing, if any excess is not going to help you. It tells us about our workouts. Are we more inclined to be more endurance or more power and strength? How you are with gluten, dairy. Are you a snacker? Do you have a high sensitivity? Can you taste fats? Do you have a sugar craving? Are you a snacker? Things like that. It's really an interesting test. And again, it doesn't mean that's your destination. It just means this is how you're programmed.
Sure. Yeah. And we saw that firsthand with leaky gut. My daughter had leaky gut and did a food sensitivity test, and like everything she was eating came back as a low grade sensitivity. But the doctor we were working with at the time had her take everything out as she was repairing her gut, and then reintroduce things to see what she was truly reacting to. But oh, what a process. But game changing if you can find that you have leaky gut, which a lot of people do. And we just had Dr. Tom O'Brien on a couple of weeks ago.
Oh,
and
great.
wonderful job of explaining how you get the tears in the cheesecloth and
Yeah.
things leaching out into the bloodstream, and then the immune system thinking that they're foreign and attacking. So that's all super helpful, and a really good reiteration of what he talked about too. So how do you go? So somebody finds they have leaky gut, and I would imagine you're looking at zonulin on GI map. Any other indicators that you personally use to look for leaky gut and the severity of it? Because we talked a little bit about that with Dr. Tom, and he talked about the Zoomer test, the gluten Zoomer test, being kind of the gold standard. But are there any other things that you are looking for to look for that extent of leaky gut? Because yeah, if you have leaky gut, I mean, it's just, you're gonna have a really hard time healing anything, and especially an autoimmune illness.
Correct. Yeah, I will use the gut zoomer and the wheat zoomer like Dr. Tom O'Brien does. I love those tests as well. They're very detailed and they really show how extensive it is. I find that some people get a little overwhelmed with all that information because it's really like speaking a different language. So when there are certain people that if they're so high that I will order that follow-up test just to make sure we know what we're looking at. Same thing with gluten. If your anti-gliadin is very high on that GI map, I'm going to suggest we could do the wheat zoomer or the cross-reactivity. For sure, you're going to get the cross-reactivity and autoimmunity Cyrex Labs test, because it wouldn't be prudent of me not to do that, because again, you could be not eating gluten, but you are still in a state of inflammation with sorghum or eggs or potatoes or dairy or something like that, that you're saying, oh, I'm not eating any gluten, but you're still creating that antibody production. So those are the tests that I do. And how do I treat leaky gut? It's a slow process. Unfortunately, it's not a quick fix. I wish it was, but it isn't. I'm always working on my gut personally, and I've been through all that. but I have a product called Gut Reboot, which I absolutely love. I will not live without. It is L-glutamine, slippery elm, marshmallow root, zinc carnosine, aloe. It is everything that you would give a hug to your intestinal lining. And collagen, I'm a huge fan of collagen. I have at least one serving a day. So I have a collagen shake every morning. And sometimes I have two. If I'll have one for dinner sometimes. Or I have collagen bars. And then bone broth is really, really, really helpful, the kind that's gelatinous at room temperature. So I'll sip on bone broth from time to time. And then fiber is really, really essential for, so lots of vegetables of different kinds, lots of phytonutrients, different colors. Those are all very, very helpful in helping to heal a leaky gut. And it just takes time, but you can get there. I'm working with somebody now who has extraordinarily high levels and is very sick, very fatigued, just really struggling, stomach aches, headaches. It's really, and it's going to take a while. So it just does. But removing all those foods that are causing the leaky gut, the tears in the cheesecloth, to replenishing and repairing.
Yeah. And is the gut reboot something that you developed personally, or is that just something that you have found to be really helpful? I mean, I have a full script account and my students use that. Is that a product that you are involved with, or?
Yeah, it's a product that that's on my label that I make. So yeah, so it's not on full script.
Okay.
But yeah, but it's on my website. But
Okay.
it's been the most amazing tool to help a leaky gut. If you're really leaky, I'm suggesting 2 scoops a day in water right before food. I put it in my shake because I've been doing it for so long. But if I have a shake, which I typically do maybe 5 days a week, it's in my shake. So about 90 days of that protocol, depending on how bad it is. Somebody with a very elevated zonulin is going to need more time, but every body heals differently, as you know. So it's each person is different.
Okay, good to know. Yeah, we went through a very, very similar protocol, and it does take time. And it's like people want to see quick fixes, but if you actually want to heal and find the root cause, it takes a while. That gut membrane is 1 cell wall thick. I mean, the turnover is usually a couple of weeks with the intestines, but to actually see the symptoms start to resolve takes some time for sure. But there's hope. I mean, once you find out, it's like, does anyone want leaky gut? No, but once you find out like that's your issue, it's like, oh, okay, like now I know what I'm dealing with, and I know how, if we can work with an expert like you to help fix it, it's so, so, so helpful. And I agree with the collagen. People ask me about collagen all the time, and we talk a lot about, protein on this podcast and getting enough protein, but collagen is a different type of protein. So it's very helpful with hair, nails, gut integrity, and those types of things too. So I'd love to ask you more about since you have gone through Hashimoto's and overcome that yourself, or I'm sure, it's something that you're always still working on and checking, but what do you see as the relationship between Hashimoto's and blood sugar issues and insulin resistance? Because my main focus is helping people reverse insulin resistance, but in my experience, like a good amount of people struggling with thyroid issues and mostly Hashimoto's, 80 to 90% of them also have insulin resistance. So, that hormonal network, it's always talking to each other. It's like if we have one hormone out of balance, there's other ones as well. But do you see anything specific in the relationship between the thyroid hormone and the insulin resistance pancreas that you would like our listeners to know about?
Yeah. So as you said, the whole body is one interconnective unit, and we all talk to each other, and we're connected. So when something's out of balance, other things get out of balance. I think the best way that you would tie them in together is again, it starts in the gut. There is something that we look at called short chain fatty acids, and that's butyric acid and And basically that is something that we should be making in our mucosal lining. And there's certain bacterias that the good guys that should help us make that. The short chain fatty acids. And there's a few components that we need in order to be making that. Akkermansia muciniphila is a really good gut bacteria that we test for on the GI map as well. It's really protective. And a lot of people, I'm shocked how many people have zero, like absolutely zero. So when you start into the gut, so there's a protein enzyme called AMPK, and that's really important for brain and liver and kidneys, and that is that protein is so important for your overall being, and that helps. It connects with your blood sugar regulation because it's protective for the pancreas, and that pancreas is what pumps out that insulin. So AMPK is a really important driver for the pancreas. So again, it's that gut microbiome that needs to have homeostasis, so that balance, right? And when we're dysbiotic, we're out of balance, then everything gets affected. I have a supplement called Post Biomax, which is a postbiotic, which is basically butyric acid. It's a short chain fatty acid, and it helps with blood sugar as well. And then berberine I use as well. Berberine is just so incredibly important. You probably talk a lot about berberine here, but it helps with regulating blood sugar and things. But again, it's how much are you absorbing in the gut? What does your microbiome look like? How many good guys do you have that is creating a healthy environment for your pancreas to be pumping out the right amount of insulin, especially if you're eating a low carb or low sugar diet. It shouldn't be working that hard, right?
Right. Yes. And that's where so many people get frustrated. They're like, I'm doing all the right things. I still have these, cravings, and I'm still hungry after I eat a full meal. And not many people are tying that back to gut health and dysbiosis and having some, overgrowth of one thing that shouldn't be overgrowing, and not enough of something else. And yeah. And people ask me about probiotics a lot, not as much as they used to. I mean, like 5 years ago, everyone was asking me about probiotics. It's like, well, I don't give like any one probiotic recommendation to everybody, because unless like spore based a little bit, but I could be telling you to take some probiotic and you have a lot of that bacteria, and it's actually going to make your problem worse, whereas the next person may really benefit from it. So I think probiotics get really challenging. So maybe you can talk a little bit more about that, because what I usually recommend are fermented foods, and just like a teaspoon of, like, have a bunch of different fermented foods in your refrigerator, and take a teaspoon of, or a tablespoon of whatever, one day, and a different one the next day. But again, people, and some of it goes back to wanting a quick fix, but what are your thoughts on probiotics, and how are you usually recommending those?
Yeah, so I love that you said that to people, because fermented foods are natural probiotics. And it isn't, again, a one size fits all. So that's why I also look at the stool test, because I can see how much good guys and bad guys we have. Some people just have no good guys, right? Some people have totally enough good guys, but so much overgrowth and bad guys. So again, it's a personal situation that I just customize per person. But I can tell you that we are seeing the most growth in the probiotic space. We are just on the cusp of really talking about an explosion of knowledge in probiotics. And I just started carrying a GLP probiotic that will help with the satiation hormone. And then we're seeing blood glucose, blood sugar probiotics specifically designed for these things. And so we're getting a little bit more specific in our probiotics for different purposes. And I love that we're going in this direction, because this is really a big missing link. And I'm just so grateful that people are really diving in and figuring this out, because we don't know. There's still so much we don't know in the microbiome, but we're starting to unfold. So it's very exciting. That's the most exciting space that we're walking into.
Yes. And I'm very grateful for the research as well. And yeah, we just don't want to like do something that's more harmful when we're thinking we're helping, and testing is always the best, the best route to go. Can you
Right.
talk
And then one more
about,
thing I just want to say on that is that, a big mistake that some people make, if you have SIBO, small intestinal bacteria overgrowth, which again, I can pretty much tell on that GI map, you should not be having a prebiotic. It's going to make things worse. And you do hear that person who takes something like spore probiotics is not great for everybody, but so definitely somebody with SIBO is not it would not I would not give you a prebiotic in your probiotic, which so many of them have. So I would specifically design a probiotic for your particular health situation.
yeah, SIBO is a hard one to, to work with. Can you talk a little bit about Canada and Canada overgrowth? Because I do have a lot of students that I work with who just struggle with cravings, or they want to eat at night, even though they've had 2 or 3 filling, balanced meals, and they just get that. I need to eat something. I need something sugary after my meal, or having some bloating issues too, and how that relates back to Canada.
Yeah, well, we can't be selfish and not feed our yeast overgrowth now, can
Right.
we? Yes. So yeah, as you said, that yeast, it thrives on blood sugar, dairy, and alcohol, basically, anything that turns into sugar. So it's, imagine if you had kids and you didn't feed them. They'd be knocking on the door, Mom, I'm hungry, I'm hungry. So, they pound on the door and say, feed me, feed me. So if you have that, then definitely get tested and make sure that you're addressing your candida or candida, and it's very normal to have those food cravings when you have yeast overgrowth, because it's nutrition.
Yeah, I never know if it's Canada or Candida. I hear it every every which way.
Tomato,
Where
tomato, I think, yeah, every way.
yeah, and it's something I think I've struggled with for a long time, is just some overgrowth. And it's so funny because I've done all this gut testing for my kids, and it's like, well, did I do it for myself yet? No. Like I just,
Isn't that funny how we do that?
as a mother, like you put your own health on the back burner, and
Yeah,
all
I get
family
that.
members are coming to me, extended family. Oh, what do you think this is? But yeah, that's something that, because I get bloated really easy, and so I wondered, I should work with you deeper.
Yeah, well,
Travel everything.
bloating can come from lack of digestive enzymes, right? And we should be making our own digestive enzymes. We do from the time we're born to the time we die, but as we age, we produce and excrete less and less. So that's what I'm looking at. Do you have enough enzymes, right? That pancreatic enzyme or hydrochloric acid. And that would be the first thing I'd probably give you. And if that was the situation. And then the other one would be SIBO, so high FODMAP foods. Remove onions and garlic and cruciferous vegetables, Brussels sprouts, cauliflower, broccoli, kale, and to determine, are you getting bloated because you can't break down this food, or because it's feeding your bacteria that's in the small intestines? It's causing a methane gas production or water retention. That's why we bloat. So I would find out, why is it that you're bloating? Because you might be eating all the right foods, but you just can't break down that steak. You just don't have the hydrochloric acid or pancreatic enzymes to do that.
Yes, definitely. I'm glad you brought that up. And I have taken enzymes in the past. I just need to be more consistent. Again, I told my mom when she's having liver issues, and it like, take your betaine HCl so that you help and take your enzymes. But yeah, it's so funny because it's when you look at your own health and your own self, you need to be a little bit more consistent, as you're telling everybody else to have that consistency. And for me personally, I can eat a ton of cruciferous vegetables and they don't seem to bother me, but I do know of people who they do bother. And this is why testing is so valuable, because you can see exactly what is going on, and tailor it to your own self. So definitely. Are there any other strategies? A lot of people, are having blood sugar issues and weight issues. Stubborn weight issues, and I do have many students who've they've done it all. They've been on diets, they've been off diets, and even those who don't have the diet mentalities, like I'm doing all of the right things, I have the foundational pieces in place, but are still just having some stubborn weight issues. Is there anything else that you can think of that we haven't talked about, that you are seeing? We talked a lot about gut health as being, can be a cause of weight gain and that not resolving, and the bacteria. Is there anything we're missing? I know thyroid obviously can be a big part of that too, but those who might be like spinning their wheels and thinking, I've done everything and I still can't figure this out.
There are 5 reasons why we gain weight or why we cannot lose weight. Now, this is given you're eating well and you're work, you're exercising, moving your body, you're sleeping, things like that. Blood sugar dysregulation, which I know you cover quite a bit. Thyroid dysregulation, which we talked about a little bit, right? That's your temperature gauge and your metabolism, and thyroid is extraordinarily important. That free T3 is incredibly critical to look at, as well as reverse T3 and T3 uptake. And then cortisol. Cortisol is our stress hormone made from our adrenal glands, and that is a huge one. People are in chronic stress with their phones so accessible, they're working, they're stimulated, they're anything, they're emotional seesaws with, being on social media, and oh, I wasn't invited to that, and what about this? We have all these emotions, right? And why am I not like that? And why, I mean, the conversations we're having to ourselves is not helpful to our cortisol production, right? And then sex hormones. Sex hormones are a huge factor here. So whether we're in our cycle or we're in perimenopause or we're in menopause, we're having, for women, every single day is a fully different hormone day, right? Men are like this. They just go straight, take a dive. Women daily, I mean, hourly almost, right? Our hormones are fluctuating. Do we have excess estrogen? Are we taking the pill? Do we have too much estrogen from the pill? Are we blocking things and creating less estrogen? Are we having too much testosterone? I know with PCOS, we tend to have elevated levels of testosterone. What's driving that? And will that help us lose weight? No, for sure it won't when we have that dysregulation. So when all those things are dysregulated, that's 4. The 5th one is toxic overload. Toxins are a huge factor. And the average American female comes into contact with over 200 toxins just before she's left the bathroom each morning. We haven't even put anything in our mouth yet. It's just what we put on our hair and our skin and our face, right? All those toxins, and it's probably even more now, right? And then we eat the foods, whether it's at a fabulous restaurant, expensive restaurant, or anything else, we're having all these pesticides and chemicals, and we are inundated. The FDA has approved, current number is 86,000 chemicals for us to use and eat. This is way more than any country on the planet. We are approving about 2,000 chemicals a year, regardless of who's in the White House. So we are very toxic. We all are. So where do we store our toxins? In fat cells and fat tissues. So this is why we lose weight when we detox. I'm a big fan of detoxing. When I work with you, you're going to be on my detox pretty much. The first 2 weeks we work together, you'll start to decrease that systemic inflammation, increase that gut health. And yes, you'll lose weight, but I'm not a weight loss clinic. I'm all about, weight loss side effect of wellness. It's for wellness. We're going to clean out that liver, right? For your mom, we would have cleaned out that liver. So everything works optimally, right? That's the key to the castle. So toxins are huge. I cannot tell you how many people come to me going, I've done everything. I can't lose weight. I just was working with somebody yesterday. We were reminiscing. We just got her follow-up blood work, which has moved tremendously. And she's lost 12 pounds. And she came to me, she goes, there's no way I'm going to lose weight. I just cannot lose weight. So we lost 12 pounds, in a few months. So, and she's done it slowly, but we are, again, looking at the root. She had some parasites and some yeast and some overgrowth. And she's not going to lose quickly when those invaders are in your gut, because we hold on to our resources when we're in a state of urgency, right? When there's a fire in the basement and you've got somebody on the second floor going, can you help me change the light bulb? You're like, what? I've got a fire. I've got the fire department coming. I mean, I'm grabbing all the valuables and you want me to change the light bulb? Like, people want to lose weight when they've got a huge fire in the basement. So we have to put that fire out first. So those are the 5 major reasons, again, given that you're eating well and you're moving your body and sleeping, those are the 5 major reasons why we don't lose weight or why we easily gain weight. And it's super frustrating.
Very much so. It just goes to show it's not as easy as calories in, calories out. People are like, oh, I don't eat a lot. Well, that very well could be so, but those hormones are all powerful. They're directing your body what to do. And if they're out of balance for whatever reason, it's going to show up as inflammation and it's going to wreak havoc on the body somewhere. So in closing, is there anything you want listeners to know, like that's on the horizon to look for as far as autoimmune goes, or that we didn't cover? Anything earth shattering that you want to talk
Yeah,
about?
I think the two places that I see we're really seeing growth are the probiotics, the special formulated probiotics, and the genetics. So I think we are getting into an age of personal health, which I couldn't be happier about. So yeah, so do those tests and get to that so you can figure out what is your particular situation, and my book, Food Frame, is about eating for your current health status, and our health status it changes, so we should be eating, not that diet book that just came out that your neighbor lost 42 pounds on, but it's the one that is right for you, right? And if people have more questions about thyroid, I have a thyroid course, Achieving Optimal Thyroid Health, on my website. That's real. I do a major deep dive on labs and what you should order and what to look for and what you should eat and what supplements to take or not to take, all that stuff. It's really comprehensive for thyroid.
Awesome. Do you see any change coming soon with the functional coverage as far as insurance goes? Because I know that that is the main barrier for people who aren't pursuing functional. Well, maybe they don't know about it, but the second is the cost, the lab testing, working with somebody who's knowledgeable. And it's so sad because that is what's going to heal people, but yet they can't afford to get care. Do you see anything coming with that?
It's so frustrating. We could be saving billions of dollars and saving lives, right? But there's so much connection between all the big food companies,
Big
all that.
everything.
Big everything, exactly. I did work with somebody a few years ago who was an executive, pretty high level executive at one of the insurance companies, and he couldn't really get any answers through the conventional medicine paradigm. So he came to me and he kept saying, why do we not cover this? Because he paid out of pocket. And so I said, could you just go to these meetings and tell them, like, even just nutrition would be helpful, but just functional testing and things. I don't know. I'm not in that world, so I don't really know if that needle is moving. And I hope that it is. There's so much profit in being sick, so I'm not that optimistic, but it's something that I just started looking into how I want to spend some time giving back, and that is I got to fight for us because we can't leave our children and our grandchildren this world. We're getting sicker and sicker. So
Yeah, it is hard because we need to make a living. We need to charge for our services too. They're just not usually reimbursed. When I look at what the cost of like my main course is compared to what people are spending on tests and medications, I mean, it's a drop in the bucket. Like you said, we could be saving billions, but until we move from the illness model to wellness model, it's just where we're at right now. So, well, this has been a very enlightening conversation. Can you tell us where to find you, how to work with you, and how to learn more about you and your services?
yeah, they can find me on my website at Risa Groux Nutrition. It's RISAGROUX Nutrition, and all my social media is Risa Groux Nutrition. And my book is on my website along with my supplements, my detox, and my book, Food Frame Diet is a 4-letter word, could be found there or on Target.com or Barnes and Noble and Amazon as well. And I work with everybody all over the country. We just do it via Zoom.
All right, great. Yeah, the telemedicine is really, really nice that you can work with anyone, anywhere. So we will link all of that in the show notes. Thanks for all you do to help heal people and get them well, and keep doing what you're doing. Thanks for coming.
Thank you. And you're the same. Thanks for having me.